Well, good afternoon, everyone. Thanks so much for joining us today. I'm Beth O'Hara-McClavick, and with me is Lee Curtis today. We are outreach and education consultants here at Community Health Options. And we really appreciate your taking the time. We're excited to engage with our members through these webinars, as well as some in-person sessions across the state this spring. We have one quick logistical item before we get into the agenda for today. All participants are going to be muted during this session, but we do want to answer your questions. So if you could please use the chat function within Zoom and send your questions directly to Lee Curtis. It's Lee and last name is C-U-R-T-I-S. Most of these we'll answer toward the end of the session unless we can do a quick clarification as we're on a slide and as we go along. If any members are joining today or covered with health options by a group plan, please let Lee know that as well. Within the chat function, some group benefits may be slightly different. So why we are here, we really want to make it easier for you to understand your community health options plan. So this 90-minute session will cover a variety of topics, ways you can save money on medical and prescription costs, features of your member portal, understanding your explanation of benefits and other forms. We're going to go through a few of those. And then Health Options Online, which is our new behavioral health telemedicine benefit. We have about 60, 70 minutes of this presentation. We're going to leave 20 minutes for questions. We will be sure to have a hard stop at 1:30. We know that that's what folks are planning for and that your days are busy. And so more specifically about today's agenda, I just want to mention that we're going to spend some time on the member portal. We're hoping many of you will either begin using your secure member portal or learn more about the functionality of the portal and expand how you currently get information from that secure portal. And then secondly, I want to emphasize that we'll discuss many of the benefits, programming, and services of your health plan with health options in the context of a triple aim with a focus on better health, better care, and lower cost. So again, we know you have questions. That chat function is available to you. And I also want to mention that a lot of your questions, if we don't cover everything that you are interested in today, you'll hear me refer to handouts. And I'll reference those a lot. You know, we have more information about this topic posted on our website at healthoptions.org. These slides will also be posted on our website, but you'll find a lot of information if you go to healthoptions.org, go to the Individual and Families tab, and then click on Resources, and then Guides. And that's where a lot of the flyers, additional information about a number of topics. We'll talk about other places on the website that you can find information as well. So just a few brief words about Community Health Options, especially for those of you who might be new members and joining us for the first time in 2019. Our focus is really on the well-being of our members and communities, and we are really proud of some of these following key attributes. First, that we take a member-focused approach. So we do member education and engagement initiatives, things like these member orientations. In the fall, we have had some member roundtables as folks are selecting what plan that might be best for them in the upcoming year. We've done focus groups, newsletters, and community events. We also have the opportunity for members, any member can run for the board of directors, and we have a number of members at all times serving on our board of directors and helping to guide the health plans. And we have a broad regional network of providers. We are headquartered in Lewiston, Maine. We're proud to be your local option for coverage. Member Services Call Center is located here in Lewiston. We're here in the Da Vinci building right now, right in Lewiston. And we also have an overflow call center in Fort Kent. We have introduced HMO plan designs for the 2018 plan year, so we continue to offer both HMO and PPOs. We'll talk a little bit about that. And we serve both the individual market and also employer-based group markets, and our group business continues to expand each year. So we really do want to be your partner in health. So PPO and HMO plan designs, I'm going to run through this pretty straightforward. PPO plans are defined as preferred provider organization plans. they require you to select an in-network primary care provider, and this is with us. They do not require referral for specialist care. They include out-of-network coverage, however, the deductibles and out-of-pocket limits for those tend to be less generous when you go out-of-network, and we'll talk about that. And some of our PPO plans do include our chronic illness support program. The HMO plans that we offered, these are defined as health maintenance organization plans. We do require you to select an in-network primary care provider. Now, typically, HMOs require a referral for specialist care. That's not something we've been doing with our HMOs, not required for 2019. Likely that will happen in 2020, so something to be aware of. The HMO plans do not include out-of-network coverage, and some of our HMO plans do include our chronic illness support program. Now, one of the things, medically necessary emergency services will be covered whether you get care from an in-network or out-of-network provider within the U.S. So emergency care that you may need to get from an out-of-network provider, perhaps when you're traveling or out of state, will be covered as an in-network service. However, you may have to pay the difference between the out-of-network provider's charge and the maximum allowed amount. This is called balance building. And in addition, you'll pay what you would regularly pay in terms of the applicable cost sharing, so your deductible co-insurance or co-payments. Once your condition is stabilized and is no longer considered emergency care, treatment received outside of emergency ambulance services and emergency room is not emergency care. And therefore, if you continue to get care from an out-of-network provider, the covered services will be covered at the out-of-network level, and again, only if your plan includes out-of-network coverage at that point. So it's something that you want to be considering. One of the things that we were very intentional about was to build a very broad provider network for our members. So we offer that same broad regional network for both PPO and HMO plans. We contract with every main hospital, as well as many New Hampshire hospitals and providers. And in addition, we know that a lot of folks are focused on getting care at centers of excellence in Boston and Eastern Massachusetts. And so this list in front of you are the folks that are now in network with us and have been, most of them, for many years. And places like Dana-Farber Cancer Institute, Children's Hospital, Mass General, Brigham and Women's, Faulkner, et cetera, as well as these other smaller hospitals that are listed. So please note that services received outside this network are considered out of network, and you want to consult your member benefit agreement for more information on that, depending on your plan. We do encourage you to use the Find Doctors and Hospitals tool right on the homepage of our website, where you can look up in-network status for laboratories, other facilities, hospitals, urgent care, a behavioral health specialist or facility, a primary care provider, or a specialist. And we want to talk about your secure member portal. So this slide I really want to take a little time on and emphasize the importance of signing into your secure member portal and having so much information at your fingertips when you want to access information. Really, it's a wonderful way to get your information during evenings or weekends and on your schedule. So our member portal will have some exciting new enhancements soon. It will soon offer an even more intuitive experience. But here you can do this laundry list of things. You can pay your bill online. You can set up automatic bill pay, which we recommend. You can select or assign your primary care provider, your PCP. You can review your benefits and claims. You can enroll with RX Savings Solutions and save money on prescription drugs. And you can download your member documents and your ID card and print those. So really, we encourage you to reap many benefits on the portal. Create that account. If you haven't done so, go green and have the ability to keep things on your computer or right within that portal. And to access many of these benefits, you just need to sign in. On the upper right-hand corner, you'll see a sign-in box on our website at healthoptions.org. You can register as a new user, and it will ask you just for a couple of pieces of information, and then from then on, when you sign in as a returning user, it is very easy. And you'll find a lot of information. You can see on the screenshot on the right, there's a lot of information, and we'll talk about a number of the things that are embedded within your secure member portal. Also, with the updates that are coming in the next couple of months, you're going to have, again, an easier, more intuitive way to access the information you need. It won't be so different that you won't be able to find your way around. So you will have better viewing on your mobile device if you like to access your portal from your mobile device. And your claims and accumulator information will be updated even faster. So you're going to see the ability to, see your EOB, see those claims more quickly. I'm just going to put out one reminder for those of you who may have joined us a few minutes late. Please note that your microphone is muted, but we welcome questions through the chat function within Zoom. So please direct those questions to Lee Curtis. And any group members, please let Lee know that we have group folks with us today as well. Okay, so moving on. Health Options really understands that we're in this together. So Health Options, the providers, and you, the members. So together we can achieve the triple aim. And you'll see here the triple aim talks about better population health, better patient care, and lower per capita cost. So we're going to cover these topics on the left, and through these next few slides, we're going to walk through how we can provide you with the tools and resources to manage your health and wellness, and how you can use your health plan to take advantage of all the benefits that it really offers you. So things like taking personal responsibility for your health and doing that wellness assessment, utilizing care management as needed, lowering your costs by accessing the right care at the right time and in the right place, understanding your formulary, the list of drugs and medications that are covered, and saving money on those prescription medications. So we're going to go through this step by step. And regarding better health, all Health Options members are required to select a primary care provider. You'll hear us refer to your PCP. And scheduling, the reason we do that, the rationale behind that, is really scheduling regular wellness visits with your PCP is one of the best things you can do to protect your health. When you enroll with us, you need to choose an in-network PCP for yourself and for covered dependents. And you can choose a different PCP for yourself, your children, maybe you may be choosing a pediatrician for them. If you don't choose a PCP for each dependent and for yourself when you enroll, or if the PCP you choose is not available, we do assign one for you. That doesn't mean you can always choose. You can change a PCP in the middle of the year, so that's something that you have control over. But we do encourage you to go to your member portal and select My Providers and make sure that you have selected your PCP, and if not, please do so. You can, again, do that right within your member portal. Right within the dashboard, you'll see My Providers, and that will take you to the provider directory. And please note, we'll talk more about preventive services, but free preventive screenings and wellness visits must be conducted by that PCP to get the cost savings, with the exception of women's health services. So another aspect of better health, we really encourage you to complete your wellness assessment on your member portal dashboard. The wellness assessment is quick, it's easy to use, I've done it, it adapts to your answers, and you only get asked about things that have to do with your lifestyle. So in about 15 minutes, you'll see how your habits are impacting your health, both today and in the future. So you may get some questions about what you eat, how active you are, how you feel, and then you get a report at the end that will show you some of the things that you can do to stay well. And often it just takes a few simple changes to your daily habits to really make a difference. So again, the action item here, we really do encourage you to go to your member portal, select health and wellness, and complete that wellness assessment. Tobacco cessation. So we've got plans that cover the cost of nicotine replacement products and other medications approved by the FDA for tobacco cessation, both prescription and over-the-counter when prescribed by your in-network provider. So over-the-counter medicines covered at no out-of-pocket cost may include nicotine patches, gum, lozenges. Prescription FDA-approved medications are covered for 2 90-day treatments. We know sometimes people need to go back and try to quit tobacco habits more than once. So that coverage is for a total of potentially 180-day supply within that calendar year at no out-of-pocket cost. And also covered a quit tobacco programs, education and counseling. For additional support, there's an 800 Quit Now line to reach the main tobacco quit line. So these benefits are available to members who have enrolled as a tobacco user. I do want to mention that those who take advantage of our tobacco cessation programs and are no longer tobacco users when they sign up next year for health insurance will have the opportunity to enroll without the additional tobacco surcharge on the premium the following year. So we encourage you to reach out. We'll talk more about our care management team at Health Options. They can help you access resources and develop a plan of action. Health Options Online, our behavioral health telemedicine service, is brand new for 2019. We have an exciting new platform that increases access to a larger group of behavioral health providers for mental health and substance use disorder services by partnering with American Well. And we're excited this is going to really improve access to behavioral health services, help folks who have distance and geographic challenges, et cetera. So what this program is, our behavioral health telemedicine program and telephonic service provides online access to specialized behavioral health providers. Again, for both mental health and substance use disorder services, can do that from the convenience of your home. And you can access it through a smartphone, a tablet, a computer. It must be something that's interactive audio and video telecommunication. So behavioral health psychiatry, psychiatrists who help manage and prescribe medications related to mental and behavioral health diagnoses, as well as qualified practitioners who do behavioral health counseling and therapy services. So this new feature really will help reduce the need for members to travel long distances to see a practitioner, provides the same cost structure as an office visit, and provides members with another option to quickly see a psychiatrist for a follow-up visit after discharge from the hospital. So you can go to the member portal, select health and wellness, and click on Health Options Online. I will remind folks that telemedicine does not include the use of audio-only telephone or facsimile or texting or email. And so it does need to be that combination, interactive audio and video telecommunication. And we also have on our website, I know I will keep referring to handouts that we have, but there's a frequently asked questions handout about the telemedicine benefit that outlines exactly how someone can access these services. And I want to reiterate that this program really underscores Community Health Options' commitment to making sure our members are able to access the behavioral health services they need. For 13 of our 15 individual plans, those first 3 outpatient behavioral health visits are at no cost. So preventive services are part of a healthy lifestyle. They help you avoid or detect health problems early. And the best part, there's no cost to you. So we really want to encourage you to use them. By enrolling in a health plan, you have access to the preventive services at no cost that are appropriate for your age and gender. So we encourage you to schedule your preventive health visit now. We want to clarify, and the reason for this slide, to clarify that everything may not be preventive. So an example here, if you look at that second line with the mammogram, some diagnostic services will involve tests like a mammogram that are also used in preventive services, but they're not considered preventive if part of the diagnosis of the new condition, if it's part of a diagnosis of a new condition or treating an illness or injury. So it's really important that you understand that distinction. And we want to talk a little bit about the preventive services that really cost you nothing. So look into shots for children to protect them against disease. Measles is in the news everywhere right now. But, you know, diseases like mumps and measles, screening mammograms for women ages 40 and over every 1 to 2 years, the annual flu shots, for example. And please note that 2 things. One, the free preventive screenings and wellness visits must be conducted by your PCP to get the cost savings. with the exception of Women's Health, as we mentioned. And Health Options website does have a listing of current preventive services coverage at healthoptions.org. So what you're going to do is go to the homepage, check out individuals and families, resources, and then guides to get that preventive list. Kaiser Family Foundation at kff.org also has a great list around preventive services. And that's something you can discuss during your annual wellness visit. And for example, when you go for that annual wellness visit that's a preventive visit, you want to know that the two items of blood work that will be covered by Health Options at no cost are going to be your lipid panel and your diabetes screening blood work. Other blood work must be ordered that will not fall under preventive at no cost. So that's something you want to be aware of, that what is being ordered for you, which tests your doctor wants to do. You can always ask those questions. We're not trying to interfere with those clinical questions, but always a good idea to ask your doctor what tests that they're doing and know which ones are going to be covered under your preventive services. Another aspect of better care, we really laud our medical management team. Our care managers are registered nurses, licensed social workers, dietitians, certified health coaches who are partnering with the providers, with local services in your area and other care managers to support our members with their health concerns. We help members who need additional support to manage their health and healthcare by answering general or complex medical questions, assisting members to address the barriers for care, and helping with complex care management. So what might that look like? There may be critical events that happen. It might be an accident or an illness that comes on acutely. It might be a new diagnosis and you need to find out how their support in your community might work. Care transitions where you're going from perhaps a hospital stay home with new medications, and how can I learn to manage those new medications? Or intensive medical or behavioral health needs. So those are all the types of things that our care managers are really there to support our members with. To reach our care managers, you only have to call member services at that 855-624-6463 number to be connected. Member services is there Monday through Friday, 8 to 6, and our care managers are available 8 to 5. So those calls get escalated up through member services. And we really call this out as a very unique program. It's something that is at no cost to our members and is widely used and much appreciated by the folks who really can use that support. So lowering costs, and we're going to focus on a number of things in this space. We want to emphasize that having your PCP coordinate your care, and many PCP offices now have extended hours for seeing their patients and helping them to avoid the more expensive and long waits at after-hours facilities when their patients really need more routine care. So important to know where to go for your care. This chart can help you understand, based on your healthcare needs, where you might go. So if you start out from the top to the bottom, things get more expensive. Certainly we encourage you to look at the Health and Wellness tab within your member portal. It's no cost, a lot of resources available to you. Again, the Health Options care management team that we just referenced by calling through to member services at no cost to you. Primary care provider, you'll see there's obviously a cost involved there. Specialist is going to be more expensive. And then as you move down through urgent care and an emergency department where things become very expensive. So within our resources page, again, individual and families tab, and then resources and then guides, there's a great reference there that's called Understanding Your Medical Benefits. And I encourage folks to look at that. Again, we know that cost is a real issue for folks in healthcare right now, and we want to make sure that we can provide whatever resource we can to help you manage and control that. Another aspect of lowering cost is around understanding the drug formulary. So the formulary is that list of drugs covered by your pharmacy benefit. It's found on our website, and the medications are listed by classification. So you'll see these three columns that you see on the right: the drug name, the drug tier, and then any requirements or limits. So that first column is going to talk to you about the name of the drug, If it's all in caps, that's going to be a brand name drug. Lowercase is going to be a generic drug. And you're going to see this formulary on our website. You're going to select medications and pharmacy toward the bottom of the homepage, and then click on View Drug Formulary. Very easy to search by just doing a Control F, the find feature, instead of trying to go all the way through what is a very, very long formulary. Probably the biggest concern on this is just to get the spelling right. So I know if I can do that on the Control Find, I can usually find exactly what I'm looking for. The abbreviation meanings are listed at the front of the formulary document, so you have a key to understand any of those abbreviations. Our formulary is updated monthly with additions and new medications. It's also updated in January and July with any medications being removed. So decisions for that process are made based on member utilization with a focus on providing members with the lowest cost options. And before any medications are removed, letters are sent in advance to members who are currently taking those medications. Again, within that list, the resources list that I've referenced before, there's also a pharmacy benefit handout. And that second column that you're focused on with the drug tier, you'll see that out-of-pocket costs that you will actually pay are going to be determined by the drug tier. So tier 1 are going to be your best value, your preferred generics and lowest cost. Tier 2 are your generics. Tier 3 are a combination of non-preferred generics and preferred brands. Tier 4 are your non-preferred brands. And Tier 5, those are your specialty medications, either SP for specialty or MSP for mandatory specialty, and that's where you're getting into the more expensive medications. So I encourage you, you really want to look at the tier that the medication is listed as, not just if it's brand or generic, because the tier is going to determine what you're paying out of pocket. More specifically, Express Scripts is our pharmacy benefit manager, and there's an easy setup for home delivery. I want to emphasize this slide as we're going through so members can really consider ways to save money. We know that prescription costs are a significant driver to rising healthcare costs, so really want to spend a little time so folks can understand what they can do here. Within your member portal, our members can sign up for home delivery of your maintenance medications within Express Scripts. And to take full advantage and activate the personalized services, you simply sign into your Health Options portal. We've talked about before, that secure member portal. And then click Get Started Login for Express Scripts on the Medications tab. You'll see here, and I'll say it for those on the phone as well, the Express Scripts mail order pharmacy is at 800-462-6605. And once you're in the Express Scripts portal, you can sign up for home delivery, see ways to save money, look up prescription costs, print forms. An example of a way that folks are saving money through home delivery, if someone has a maintenance medication and they're going to be taking it for a few months, and they have a copay for each month, they can order a 90-day supply, which would be normally 3 copays, and get that cost for 2 copays. So again, opportunities to save money if you can be looking and see what's available, and especially Express Scripts offers some of that. And just a last thought about pharmacy and prescription drug benefits. Accredo, our Express Scripts specialty home delivery pharmacy, is our exclusive source for specialty medications. So by filling specialty prescriptions through Accredo, members pay only their plan's cost share. So if it's an SP, which is a specialty drug, the plan does offer you to get 1 courtesy fill at a retail pharmacy as a covered benefit, but then the drug must be obtained directly through Accredo, or you would pay 100% of the retail cost. Mandatory specialty pharmacy, this means that the out-of-pocket cost is at that specialty cost share, and the mandatory specialty pharmacy rule applies. The drug must be obtained directly through the exclusive mandatory pharmacy. So through Accredo, through mail order, or the drug is not covered. And again, these designations are going to be for very expensive medications. And our chronic illness support program. So our CISP program is a unique and signature benefit that has been offered within certain health options plans since the beginning. And members diagnosed with these conditions that you see across the slide, diabetes, asthma, chronic obstructive pulmonary disease, hypertension, and coronary artery disease. Folks who are on these plans who have one of these chronic diseases receive lower out-of-pocket medical services and pharmacy costs for these conditions. We have compiled cost-saving data, and it's showing significant savings for our members with chronic conditions who utilize CISP to help with reduced or no-cost medical services and prescriptions. So the bottom line is that CISP is working. For 2019, 5 of our individual and family plans offer this CISP program. We do have a handout for this online. You can see that part of the benefit here is around prescription drugs. There is no cost for specific Tier 1 generic medications within the CISP program that are used to treat these conditions. For Tiers 2 and 3, the deductible is waived and the cost share is according to the plan design. So some of these prescriptions make a big difference for a lot of our members. So if you or a dependent has one of these chronic conditions, you want to review those plans that include the CISP benefit for your 2020 selection. And in addition to our relationship with Express Scripts, we have added an additional platform to help members save money on prescriptions, and that's RX Saving Solutions. So we've partnered with them, and we're now able to provide you with a personalized, easy-to-use search tool to help you manage your prescription costs. So you'll see here, on average, our members save $300 per year by using this. You see a few testimonials beneath there. One of the members has said, I've been able to use one of the solutions provided to me on one of my prescriptions. It's giving me savings of about $30 a month. And you can access RX Saving Solutions on your member portal. So again, your portal is the key in the opening to all of these opportunities. RX Saving Solutions will work with the member's physician and the local pharmacy to ensure that the member will receive the most affordable access to medications. So one of the things that I actually went on a webinar that we had because I'm a member of Health Options, and one of the examples that they gave was a cream that was going to be close to $100. It was a topical cream, skin cream for somebody, and by using 2 different generic prescriptions and prescribing those and working with the provider to do so, the individual was able to save around $90 of that close to $100 cost, and I think it ended up being $6. So that's what convinced me that there are opportunities, there are ways in which you can learn about what might be available to you in terms of cost savings. Once you log in and register for the tool, you can opt in or out of receiving proactive savings alerts via text or email. So wanted to give you a chance to get a look at the invoice. This only applies to individual members only, not group members, and I know we have some group members with us today. But we split out the invoice so that it was a little easier to see. You'll see the top portion there on the left. What I want to draw your attention to is just to remember that the invoice shows what the full monthly premium would be, but also lists the advanced premium tax credits that you may receive and that are being applied to that full premium. And then the amount due is what you actually owe, and you'll see the due date is always that first of the month. So just showing folks that if you have any questions on that, you can certainly reach out to member services, but that is something that we've tried to make over time as clear as possible. Regarding the payment options for the first of each month, and again, this is for individuals and families, members can make a payment by logging into the member portal, clicking on that Pay My Premium button, and if this is the first time using the member portal, they can get a step-by-step guide that's available on the website. They can also access the automated payment line at that 844-722-6243 number. For debit card payments, they do need to have the member ID card and the debit card number, as well as the security code and expiration. And by check, the member ID number, the bank routing number, and the account number. The Community Health Options Box 326 is strictly for Checks that are mailed in, you do need to include your invoice coupon and your policy number on the check or money order. And please note that we do not accept credit card payments. We do encourage our members to set up auto pay, which again can be done through your member portal. And again, online payments can be made for one time only. You can set them up recurring. So a lot of different options in that space. So explanation of benefits forms, and apologies, this is a little bit blurry. The sections that you want to pay the closest attention to are your responsibility, and then that copay, coinsurance, and deductible section to the right. So those three columns to the right of that. Any help you need with your EOBs when you see them within your member portal or receive them, you can certainly reach out to member services, again at that 855-624-6463 number. But what's really nice about your portal is you can select My Claims within the portal and have an opportunity to look at your explanation of benefits and review those before you had ever received them in the mail. We're excited with the new portal that will come in the next couple of months. Things are going to move more quickly. The claims and the accumulators will be, all of the accumulators will be happening more quickly, and you'll have access to those claims more quickly. And you will be able to receive those electronically, again, through the member portal. And someone had just asked that as a question, so we'll catch that question on the fly there. And yes, that's the best way to do that. And anyone who needs any help, if they're feeling like they've never done the member portal, please do reach out. We can talk you through that. Again, we have a step-by-step process on the ways in which you can get onto your member portal and some of the functionality within that. And that's really an important opportunity for you, as we discussed earlier. This next slide just shows you a fictitious view of what the claims might look like within the member portal. And you'll see on the right of that screenshot the opportunity to tap on that EOB and get that explanation of benefits. You can print things out, you can download documents, and it's really an opportunity for you to self-serve and understand what's happening with your own healthcare, with your own costs, and if you're nearing some of your deductible or out-of-pocket maximums within those accumulators. So putting it all together, we know we've been throwing around a lot of copay, deductible, coinsurance, out-of-pocket maximum terms, and those are all the costs that you pay with the utilization of your health plan. Just want to clarify some of that and point you to some additional resources. If those kinds of things are just not typically something that you spend a lot of time on or very clear for you. So copays are those specified dollar amounts for specific medical services or prescriptions. Copays do not count toward your deductible, but they do count toward your out-of-pocket maximum. The deductible, you'll see some of the services that you have are covered, or some of the prescriptions, some tiers of your prescriptions may be covered, and it says deductible coinsurance. The deductible is that amount that you as a member are responsible for paying before insurance starts paying. So if you have, for example, labs or hospital stays, you may need to pay a deductible up to a certain amount, and then the coinsurance kicks in once that deductible is met, and the member is going to be responsible for a certain percentage of covered costs until the maximum out-of-pocket is met between your deductible and your coinsurance and your copay. And again, your deductible and your coinsurance and your copays are all counting towards that out-of-pocket maximum. It's the upper limit that a member will pay for in-network covered services that the plan covers during that plan year. So having said all that, just to do a quick review of this slide with Jane, if you look at the beginning of the year, Jane may feel like she's paying quite a bit, she's paying 100% perhaps in that first column. She hasn't reached her deductible yet. She may be paying $20 copay for some provider visits and medications. And when she's paying the deductible, she may be paying 100% toward the deductible for other costs, if she has lab work, out of outpatient services, until she meets that deductible. As we move into that second column, she may reach that $2,500 deductible and her 40% coinsurance begins. So she's still paying a set copay for some provider visits and medications. For other healthcare costs, she may be paying 40% and Health Options is paying the other 60%. And then when she reaches, if she reaches, her maximum out-of-pocket of $7,150 that year, she has seen her providers often and has had perhaps surgery that has brought her up to those limits. She has paid $7,150 on her out-of-pocket total, and Health Options is now covering 100% for all covered costs for the rest of the year. Again, covered costs, and this is in-network, including office visits and medications. And the two things I want to just emphasize are covered costs, so it has to be something that your plan covers. For example, we don't cover cosmetic surgery. And it also has to be in-network. If you move to out-of-network, if you're a PPO, on a PPO plan, you're out-of-network, all of those copays, deductible, coinsurance, out-of-pocket limits are going to be different and higher, a separate bucket of those. So there are times when we've spent a lot more time explaining these terms. We are trying very hard to address what people most want to hear in a very short webinar. If these terms are still kind of confusing, we have some help at your fingertips. So we have videos, 90-second videos, that differentiate some of the terminology that we are using and that are really important for you to understand if you're going to understand your health plan and the costs that you're responsible for. And if you go to healthoptions.org and you choose individuals and families and then choose resources, we have a number of videos, and some of the videos actually cover, these are the short ones, they're easy, quick hits. One covers premiums and copays, one covers deductibles and coinsurance, and another covers the maximum out-of-pocket. So I encourage you to look at those and to really understand how all of that works and how you can best utilize your health plan and control the costs that are yours to focus on. And we're coming toward the end, just a few more slides here. These are important numbers to remember. I won't walk through all of them. We've talked about member services that are there Monday to Friday except holidays from 8 to 6 at that 855-624-6463 number. The medical management team, our care managers that are available to all members, are there 8 to 5 Monday through Friday, and again, same phone number. Our behavioral health team, the Community Health Options Behavioral Health Care Partner, is through Maine Medical Center Behavioral Health Care Program, and it's available to assist members with behavioral health requests from 8 to 6. They also, there's a telephone line that is available as a crisis line after hours, 24/7, at 855-481-7047. And then you can always contact us by mail, and please use this following address, the Mail Stop 100, not the PO Box 326. That's only for payments. The Mail Stop 100, PO Box 1121 in Lewiston. Please note that if you want to reach to member services, if you want someone else to speak on your behalf, you do need to fill out what's called a PHI form, a Protected Health Information Form. They're available on our website under Individuals and Families, and then Resources and Forms. And it's important, if you think that someone is going to need to be speaking to Health Options on your behalf in an ongoing manner, it really behooves you to fill that form out, and there are instructions on the form on how to return that to us. Otherwise, if you give verbal permission, somebody can speak to us on your behalf, but that only lasts for 24 hours again, so it's much easier if you're going to have an ongoing concern to have that form with us. In addition to the videos I just mentioned, we do have additional videos on our website, so it is, I think, interesting for you to see some of the things that you can self-serve on. This will also be, we'll post this webinar, we'll have the slides available as well as the audio, and you can have at any time access to these videos. And they are on the Health Options website, Individuals and Families, under Resources, there are videos. We also have some interesting videos if you go to YouTube and search for Community Health Options, and you can see what we have available there as well. So as we address any questions, again, please send those on to Lee through the chat function on Zoom. I'm going to move back to the contact information just in case anyone wants to write down any of those, any of the phone numbers or time frames that you can reach out to people. We thank you for your questions and your interest. Again, the slides in the webinar will be posted on the website. And remind you that we're going to have another one of these webinars on June 5th at noon, as well as there are some in-person sessions happening across the state in the next few weeks. And if you go to our homepage at healthoptions.org, you can, on the bottom left corner, you'll see, do you have questions about your health insurance? A blog on the bottom left, and that's where you can access any registration. People must register for those in-person sessions and register for the webinar on June 5th as well. So if you feel like you know somebody who's a member and they would really benefit by joining us, we would welcome the opportunity to work with them as well. So let me go back a couple of slides and just leave this up, important numbers to remember, and check in with Lee Curtis, who's been taking some questions, and see if there's anything that we can clarify for you or answer for you at this time.
So we addressed the EOB being available electronically versus paper mail. That is available in your member portal. There's another question, why do we limit certain prescriptions to a 30-day fill versus a 90-day fill? And I was going to say our care managers are probably better suited to answer that. Those clinical questions, as Beth mentioned, they can be reached right directly through our member services line. I don't have any insight into that as to why some prescriptions are a 30 versus 90-day fill.
And I would just add to that by saying, I know that we have a monthly meeting of folks that are reviewing the pharmacy benefits that we offer in general, and we're always trying to make the right decisions on what is going to be the best cost for the member, what's the utilization like for our entire member pool, and how can we best serve our members with while also containing costs. But certainly we would encourage you to reach out to member services and perhaps escalate that question, as Lee mentioned, to our care managers to address those issues. And please send in any additional questions that you might have for us. We're happy to address those or any clarifications.
No.
So we're going to give it another minute, but we don't see any additional questions coming through. I can tell folks, I'm going to just escape here for a minute and just let you know that on our website, so if you go to healthoptions.org, you'll see this is what you're going to see. You have the opportunity to get a lot of the information that we talked about here. And I know I'm going quickly down through here, but there's a lot of information here on that homepage, as well as choosing individuals and families, and then going to resources. And you can find guides, which is where most of the handouts and flyers that cover these various topics are: preventive services, special enrollment periods, health options online, our portal guide that we talked about, as well as videos. And you'll see here the copay, deductible, maximum out-of-pocket videos. You'll also see under forms where to find your various forms. The Protected Health Information form we talked about. There's also a member reimbursement form and prescription reimbursement form. So there's a number of forms in here. And then if you go to just the individuals and families page, you'll see across these 6 topics, this is really a lot of what we talked about. So that first one is the extensive provider network. The second is dedicated plans for chronic conditions, so the chronic illness support program. The third is prescription savings and online refills, so Express Scripts and RX Savings Solutions. And then below that, here on this fourth box here is about integrating the mental health approach with the physical health approach. So our behavioral health and promoting your health, preventive services, screenings. And then this last box is our brand new behavioral health telemedicine benefit that we all talked about.
And there's another question coming in, whether someone can use a good RX discount and be reimbursed for cost. Not familiar with that program. We would refer once again to our care managers who can be accessed through member services. They may be able to answer those questions. I'm not familiar with the good RX discount, but I can bet that our care managers would be at least able to answer the question.
So if there are not any other questions, we may be giving you back some time. I will just reference one other thing, and that is that things like your summary of benefits and coverage, you can find plan documents within your member portal. So one other reason to go to your member portal and see the opportunity for you to get a number of documents that really clarify exactly what your plan covers. And there is this 7-page now, summary of benefits and coverage for each plan. Within your member portal, your summary of benefits and coverage will be accessible, as well as a very long 70-odd page member benefit agreement and a schedule of benefits. You can access all of these through your member portal and again, understand more about your plan. And I'm going to go back to just on the PowerPoint. I'm going to leave that up, so anybody who needs to grab information and resources about that can do so. So thank you very much for joining us. And again, we will be back with another webinar on June 5th. This webinar will be posted, and you can certainly follow up and ask questions with member services. So anything that is more specific may be best answered by the folks who answer these questions every day, and that is our member services team. They do weeks and weeks of training on the details and the intricacies of the plan. And they are at the 855-624-6463 number. We again thank you very much from Community Health Options and from the Outreach and Education team. And you guys have a great day. Thanks very much. Bye-bye now.